I'm David Spigel. I'm a medical oncologist in Nashville, Tennessee. I work at Tennessee Oncology and direct the lung cancer research program at Sarah Cannon Research Institute here in Nashville. Lung cancer is a common problem in the United States and worldwide. What many people don't appreciate is that lung cancer is the most common cause of death due to cancer. So we're all very familiar with other cancers that are common, such as prostate cancer and breast cancer. But if you look at who actually dies from cancer, lung cancer exceeds the amount of patients who die from breast cancer and prostate cancer combined. Lung cancer deaths account for approximately 175,000 people each year. Smoking is, without question, responsible for over 85% of the reasons patients develop lung cancer. Smoking also is present not only in a primary form but in a secondary form. So patients may have no history themselves of smoking, but they have a strong family history of parents who smoke or siblings who smoke who they've been exposed to for a number of years. And that can also account for why patients develop lung cancer and maybe don't have a history of smoking themselves. Smoking accounts for 85% of the causes of lung cancer, but there are other causes too. These are what I would call more rare causes, but these include things like asbestos, other occupational exposures. I think radon makes the news a lot, perhaps a little bit overblown in terms of the true risk and prevalence of that problem, but it is what I would call rare risk factor for lung cancer. Unfortunately, with lung cancer, the cancer itself tends to be an aggressive type of malignancy that even surgery may not be curable for patients. And that's why we've been trying to discover and find better therapies for patients. And so now, in addition to surgery, we talk about things like chemotherapy and sometimes radiation therapy. We now live in a environment where clinical studies or new therapies are widely available, not just where I work, but across the United States and really in many parts of the world. Research is available often not only at major medical centers, but often at your community oncologist's office who has access to some of these new therapies, maybe through an agreement with a nearby medical center or through a network of research, a research network that is being run throughout the country or maybe even throughout the world. I think we as a community, whether you're a patient or family or friend or healthcare provider, have to work hard at overcoming this stigma or this burden that's associated with lung cancer. It's a very common problem. It'll be the second most common cancer that is seen in men. It's the second most common cancer that is seen in women, but it is the number one reason folks will die from cancer, in both men and women and worldwide. Lung cancer is a tremendous problem, and one of the worst things I think that can happen in addition to a diagnosis is to feel guilty, bad, or burdened about that diagnosis.